So let's call the meeting to order and stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Jessica, roll call, please.
Okay. This one's broken, so I'm going to hold it while I go. Glenn Bailey.
Present.
Dr. Johnson.
Present.
Commissioner Cowles.
Present.
Commissioner Bertling. Dr. Noland.
Present.
Peggy Cavala. Chairman Fletcher.
Present. Okay, public comment session. We see we have some guests here. Now is your moment.
So Jennifer, I just wanted to say, class had been required last month. They also had additional women's time having marching band.
Well, great. Thank you. Moving on to the next agenda item, number 5, consent agenda. Are there any items on this list that any board member wishes to extract? Actually, there's one I want to. Number 2, the Health District Division and Fiscal Reports. Christine, is this something you're going to cover? Division Fiscal Reports? Okay, well then we don't need to extract it then. Fair enough. That's fine. We're good. We're copacetic. I'm positive.
That'll be under number 12, you mean, or? Yeah.
I mean, I guess if you're going to review it, it's more a question of ordering here. Do we discuss it before or after you go over the numbers, or how do you want to deal with
Chairman,
this?
she's going to go into much greater detail. This is part of the quarterly report plus a summary of the closeout for fiscal year 25. So it'll be far more detailed than our standard report.
I just am going to cover the couch history for fiscal year 25 ending and three quarters of fiscal year 26, as well as reviewing the budget to actual for fiscal year 26 in September, and then 2 weeks as well. I was planning on starting in September if we could actually get it like that. Times of the census, then we would delay June to the next board meeting. But I think it's very important to start having more regular fiscal reports. And what I would like to do in starting with the September report is give an orientation of the budget to actual, because we do have new board members here. And I just want to get everyone familiar with it.
That sounds great. Okay, well then let's not extract 2 and give you full attention later on in the board meeting. Any other discussion, interest in extractions? Okay, hearing none. Do I hear a motion to approve?
Mr. Chairman, I'd make a motion to approve the consent agenda as here presented.
Fair enough. Do we hear a second?
I will second.
You will?
Yes, I will.
Wonderful. All right. Any objections to the motion? Hearing none, the motion passes unanimously. Item 6, the mental health suicide prevention program.
Good afternoon, everyone. Thank you for having me. I am Alicia Keller, and I do the suicide prevention here at Panhandle Health. And I also do fit and fall proof, but today I will be talking about suicide prevention. Currently, these are our up-to-date statistics. I do speak with the coroner's office in all 5 counties. And looking at this, I do want to note that we can go quite a bit more in detail. I have a website. I'm always available. You can always reach out to me. My contact information is at the end of this presentation. But I would like to note that Shoshone and Boundary, although the numbers are smaller, per capita, those numbers are quite high. So I just wanted to note that in those statistics. And that is, it's current right up until the end of October. I haven't gotten the number yet. I would just like to say, and also introducing myself to and adding to that, that here at Panhandle Health, we focus on prevention. And so we do a lot of different things in our community to make sure that we're meeting the needs of our community in all 5 counties. And one of the active roles that I play is the QPR training, and it's question, persuade, and refer. And so how this works, I am a certified QPR trainer, looking to be a master trainer, so I can train others that are looking to do this as well. And it was founded in Spokane, so it's not too far from here. And what the intention of it is to go into facilities, schools, really anywhere that they are looking to educate our community a lot more with suicide prevention and what to do. So it really just adds to the toolbox for those that are trying to intervene. And more, for example, I got a call from Canopy Village not too long ago, and was asked to do a staff training of 25 people over there. And so their staff then can intervene. So if they see someone at their facility that seems suicidal or they might be struggling, they are equipped to ask the right questions. And then their role is to refer. So they would refer them to just a mental health counselor, to someone in their community that they trust. And so that is the intention of the QPR. Successfully, we have trained fiscal year 25, close to 500, actually just over 500. I just checked the numbers. So that's quite a few in all 5 counties. So I'm really happy about that. And that is a really nice way of reaching our community members and also being very active. So that's just something that I get a call probably once a week, and I'll be over at Farragut State Park. So that's coming up in a few weeks. So that's just something that has been quite positive, and the community has really appreciated that. Another part of prevention that we do the support groups. And I'm able to do the support groups here at Panhandle. I like to make sure that I'm just listening to the needs of the community as well. So what times work for them? What are they really looking for? It's an open door policy. Mainly, it is for those that have their survivor of suicide, and that really comes in a lot of different shapes and forms. So it might be a family member, and it might even be themselves. So we are an open door. We talk to them. We have support. We also reach out to the community for different counseling and different resources as well, which I'll touch on in just a little bit too. And we have 2 groups right now. When you look at the statistics and when I do talk to the coroner and I am able to talk with them quite in depth, um, a lot of means that are used are guns and also overdose with medications. So with that information, and again with prevention, we go into the community and we make sure that we supply gun locks, and those have been very well received. And we also have the medication lock boxes, and as well as the medication pouches to dispose of any excess medications. At health fairs, we also go to different community events, wherever need be, or I'll just get a phone call and I'll have someone will ask me for them and I'll bring them to them. So that's something that has been a successful and preventable measure in our community. Again, outreach. We are here. A little bit about the outreach too. I used to be a school teacher and also nursing. And with those two, I'm able to go into the schools, and we have been welcomed in all 5 counties, and we are able to do our outreach really to 5th grade. That's where we start, is at the 5th grade level. And when we go into the schools, we talk about preventative measures. So we are able to provide pamphlets, information, education. Again, it tags with the QPR because I've probably trained the teachers there, and then they're so interested, and then they want me back in the school to talk with the students. Last week was Red Ribbon Week, able to just go to the schools and talk with them, work with our nurses, work with our principals. Really good relationships have been established over time. So just making sure that we are available. If there is a situation where there was a suicide at the school, then we also we go and we partner up with different community partners, such as the Croc, as you can see up here. This was an event that was just recently done. It was wonderful. We actually had one of the counselors, Keith, and he was able to bring this all together, and then Panhandle was there to represent as well. And we were able to reach probably 250 people that night, so that was wonderful. We are always available in there to support. Again, awareness. I just wanted to highlight in this slide the 988. So we have prevention, and then there's crisis. Usually within crisis, there's 72 hours when someone is walking down that very lonely path. 988 is wonderful, and if you haven't heard of it, it's 24 hours, and you can call, and there'll be someone on the other line that can help them, and they can also step in and offer services if the phone call is going in a direction that really puts that person even more at risk. They'll have different people from the community, EMS, police, mental health counselors, and meet them right where they're at. And we had a situation not too long ago where there was a gentleman at a park, and they were able to go and help with that crisis. So that was wonderful. It's really wonderful when the community rallies like that. And 988 is integral in that. And then we have lots of resources. Again, I really do love sharing this information as much as I can. So if you're ever interested in what we offer and what we have, please reach out to me and I can talk to you about that. The resources that we do provide, it's filtered through health and welfare, and so we make sure that we have things available. And a lot of these are used in our support group that we do offer. And I have lots of copies of things too, so if you ever would like one, again, those are available. And again, resources, this is just a synopsis of what is available. Sometimes with suicide and prevention, family members, they get stuck and they don't know how to help the people that they love. And even with coworkers or church members or whomever it might be in the community, you just really hit a wall. So something as simple as this can be so very helpful with 988, with different resources in our community. I'm also working on a resource guide that will really help bring people together for preventative measures. When I did psychiatric nursing years ago, that was something that was really needed in our community, and it still is. So I'm able to work on that. So that's something that is a project of mine right now. And then lastly, all 5 counties. And so I'm on the road a lot, and we have the privilege of working with some wonderful people, different members here. We did the Benawa span of Benawa. That was a walk that we did. That was wonderful. The community really rallied together, and we did that a few weeks ago. And then we also did the NAMI walk, and that was supportive, wonderful. We did it down actually in Coeur d'Alene, right on the lake and right by the park. So the foot traffic was wonderful. Panhandle was represented in a way that I'm just really proud of. And then we also the Ethan Murray Fund. That's just that was a really wonderful experience. It was a few weeks ago where we were able to reach a lot of kids up in Bonners, up in Sandpont, and we were able to actually get into the schools. It was a 2-day project, and we were at the high school, and we were able to answer questions. I was so impressed just with the students, their candor, how honest they were, just really representing who we were so they know we're here as well. And that was just a wonderful experience. There was a guest speaker, Drew, who struggled with mental health and with suicide, and he was there and present. So it was just a time where we were able to connect. And that's a yearly event, and they'll do different things, but that's just something that's most recent that I wanted to share with all of you. And with that said, I'm always available, like I said, for questions, and we're just doing really good things with prevention. And I just thank you for your time today. So I appreciate it. Thank you.
Thank you. Does anyone have any questions?
Yes, actually, I do. Oh, I'm sorry.
Sure.
Did I jump in, Glenn? Do you want to? Oh, um, I'm trying to understand the latest status of, when someone's in severe crisis, there used to be 24-hour or 72-hour holds at the hospital, et cetera, and I thought the hospital got away from that. Then I heard that maybe they were bringing that back. I just don't know where that's at.
Right now, yes, you can still go to Kootenai through the emergency, and then there is still a 72-hour watch. And from what I know, I'll find out. And actually, I would like to know specifically if there have been any changes. But from what I know, no, the 72-hour watch is still there,
Okay.
and it is available.
Okay. Good. Thank you.
You're welcome.
Alicia, Mr. Chairman, my question is on the North Idaho suicide data.
Yes.
Have you seen the trend of fewer or more age group or sex? Those kinds of things. Can you break that down? Well,
Yes, and actually, I can pull it up for you really quickly. It's a really nice snapshot if you'd like.
That'd be great.
There's yeah, there it is. And so, and I can kind of navigate it too if you want. Okay. No, it's okay. Your questions, all of those questions are answered with this. So, so it's a really nice snapshot of answers. So I might just sit over here and navigate a little bit. Sorry. So this is the link here, and I can provide that for you. But you can see here that, let me go back over here. Type that, because I want to answer those questions that we had. So you can see that age range, this is all Idaho. So the age range 35 to 44 is, usually the highest. And then we have here a little bit lower but your medium is usually 35 to 44. Here, we've got, this wasn't your question, but we've got never married, married, but this gives you a snapshot also of who,
Alicia, are those the age distribution up there?
yes.
Is that for all from all time, or is that because it doesn't? And has that been related to like? Is that age per year? That one right there underneath there. 'Cause
This
it
one
looks
right
like
here?
the numbers would be multiple years combined, conglomerated.
Yes.
So that doesn't show like, is there a trend of an age group in the last 2 to 3 years versus over the last, that kind of thing. So
No.
yeah. Okay.
Right now, we have seen a 2.4% increase. So to answer that, yes, we have overall. If I move in more to the suicide rates, let's show you can see here, there's our increase of 2.4. I think I had another spreadsheet that I will provide for you, male and female, and it does go into detail a little bit more. This is kind of an overview and a snapshot, but I'll provide that for you so you can see. It actually gets so detailed with means as well. So, and usually with female and male, it's more. We're going to see more with male. And the guns are usually the means. But I will provide all that for you so you can take a really good look at that. And then again, here, it's hard to see because we have this here, but I don't really want to minimize it. It just shows, again, it goes into more detail with each county. So it really dissects it really well. So I'll make sure you get that.
I
Yes.
have a question about county because
Sure.
I know at one time, and maybe people will answer this as well, but at one time in our county, we had a very high rate of Benelux.
Mhm.
But many of those suicide deaths were people that actually live in other counties but would drive to a more rural location.
Yes. And
So I just don't know how that data is sorted out.
well, I appreciate that, and thank you for mentioning that. So, for example, just recently in the last few months, Shoshone had 5 suicides. Out of the 5, 4 of them were actually from Kootenai County. So those statistics in this data, it does show accuracy. So when you see that, so if they're from Kootenai County, then it will reflect their residence. But the coroner, by law, does have to state which county where the suicide happened. And then as it's filtered through, this is correct. But thank you for noting that because that was a question that I had too. So yes, that does happen. It happens quite often, but this is accurate.
Sure is
You're
okay.
welcome.
I have a question too. So on this, because you're saying in the detail, is there an ability or way to look into the detail of some of the underlying causes or drivers in the psychosocial aspect of the person that suicided, and then what drove that more than just the means? Because the means is obviously important to assess, but more getting to that root cause. Is that something that you're able to get to on some level or would like to get to more? Or?
Well, that is a wonderful question, and that's a very heartfelt question, and I appreciate that. So the answer is yes, but I have been speaking at length with the coroner's office in Kootenai, and she has very much wanted to take that question and break down the data even more.
Yeah.
With that, there's a lot to it, as we know. So there's a lot of red tape. And sometimes the family she was sharing, they just don't release the information because of HIPAA. So there are a lot of barriers, but things are being done. And the coroners are wanting to know that as well, not just the means, but what was the root cause of it. So I have worked closely with Kootenai, and she's letting me know, what things are being done. And she's actually been aggressive with this. And the other coroners are following suit with the framework that she's implemented. So I'm seeing very positive things. I don't have a direct positive answer to that, but things are being done. And Kootenai is actually definitely heading that up. Yes.
And it'd be great to meet on that another time and
I
help
would love that.
strategize.
Yes, yes, I agree, because that's a huge part of prevention. So yes, I agree. Thank you.
Did you have another question?
No, I
You
was
were
just,
reaching for the mic.
I was reaching for the mic. I was just going to make a comment in relation to that with the Cooney County Coroner's Office, that it is very difficult information to obtain because a lot of families will even deny that their family member committed suicide. So they'll say it was an accidental overdose or it was a mistake or et cetera, et cetera. So it's really hard to obtain the data. And we, even though there's an attempt to pursue it, there are barriers where people were just, you can tell we can't go any further. We just have to leave it alone and just walk away from the idea. So it's not easy. But
Any other questions?
Thank you.
Thank you very much. All right, moving on. Agenda item number 7, to enter into executive session. Do I hear a motion to move into executive session?
Mr. Chairman, pursuant to Idaho Code 74-206, subparagraph 1, subparagraph B, as I motion to go into executive session to consider the evaluation of dismissal or disciplining of or to hear complaints or charges brought against an officer, employee, staff, or related public schools.
Okay, do I hear a second?
I'll second that.
Roll call vote?
Glenn Bailey,
Yes.
Dr. Johnson,
Yep.
Commissioner Cowles,
Yes.
Dr. Nolan,
Yes.
Peggy Kabala,
Yes.
Chairman Fletcher.
Yes. All right, well, we're going to go in, if you'll stay, please. Oh,
So we're going to do it a little different today with Commissioner Cowles online, since we have that up on the screen so that people on YouTube can see that we're in executive session and all of that fun stuff. I'm going to pull up Commissioner Cowles on my computer and turn my computer around and then go from there.
before We've reconvened open session. We're now on item 9.
Well, do we need to make a motion? I make a motion to exit executive session and reconvene open session,
Okay?
just to be
Do
belts
we
and
hear
suspenders.
a second?
Second that motion.
Roll call vote?
Lynn Bailey, Dr. Johnson,
Yes.
Commissioner Cowles,
Yes.
Dr. Nolan,
Yes.
Peggy Kavala, Chairman Fletcher.
Yes. Item 9. Dr. Nolan?
Yes. In discussing our legal services, this Panhandle Legal Services, I would like to. So I should start with just a discussion here a little bit. Is one thing I would like to put forward about shifting our current legal relationship with the current law firm based off of we are currently significantly over budget and need to have I would say a semi-emergency stop loss action so that for the rest of the year where we can't afford to spend any more legal for the rest of the year. So that's one. In the process of what was discussed at the previous meeting where we talked about legal policy and legal direction from the board that has been less than what was needed. That what I would like to do is see if we can suspend our current relationship with the law firm that we're currently working with in order to have a time to develop an appropriate over the next 2 to 3 months, develop an appropriate legal policy that works for the entirety of Panhandle. And in that process, we can interact with some of the different department heads and administration just to make sure that it works for all the different scenarios that could be come up with. So, and that way there's a real clarity of moving forward. How do we not get into the same situation of being almost 5 times over our budget for our budgeted legal amount this year? So that's the general topic. So I would like to make a motion to suspend our current service contract with our current legal services, and then take the next. I guess that could be one motion, and then take the subsequent 3 months to develop a comprehensive legal services interaction plan that makes sense and works for what we actually need, so that we can contain our budget.
So it's a compound motion, suspend our legal services with the current firm,
Mhm.
and then move forward with engaging a new
Right.
relationship.
Yeah. So
And
engage
that's
for sure.
does that summarize your motion?
Yeah. To
Fair
clarify, that was a little bit long-winded, so apologize. Yeah. So the motion is to suspend our current relationship and develop a direction that we want to go for future legal counsel.
Okay, do we hear a second?
Well, isn't that item number 10, is the methodology of the legal expense? Oh, no, that's
Well,
methodology.
no,
So-
that's a slightly different issue,
Yeah, okay, got it.
which is the one I alluded to during executive session.
That would be a prelude to policy.
It's
Got it.
putting
Yeah.
some meat on
Yeah.
on the policy that Commissioner Talley was was talking about.
Got it.
Do we hear a second?
Yeah, I'll second that motion.
Any discussion? Okay, roll call vote.
Lynn Bailey,
Yes.
Dr. Johnson,
Yes.
Commissioner Cowles,
Yes.
Dr. Nolan,
Yes.
Peggy Kavala,
Abstain?
Chairman Fletcher.
Yes. Okay. Item 10. Dr. Nolan, you're on point again.
Okay, so in light of item 9 and the vote on item 9, and then there's a couple methodologies, and this is something that I appreciate also if Christine was available, needed to chime in on, although I'm looking forward to your financial report up here shortly, the is for an immediate kind of stop loss, because there might be in the next 2 to 4 weeks or 6 weeks, an urgent need for illegal interaction. So we need to have a methodology for that before we develop a more comprehensive policy. And so one of the things that I think that would be good, and we can have a discussion or all that too, but is looking at having any legal services that are needed, until the new policy is put into effect, the new comprehensive, we'll call it the Panhandle Comprehensive Legal Policy, is put into effect, would be that any legal needs are put before the chairman with a budget with basically a quote from about how much time it is thought to be needed. That's basically kind of like a bid. So like if you get a contractor to build a new deck on the back of your house, you're going to get a bid. So they say, I think it's going to cost this much. So any request would need to come with a bid from the lawyer that's desired, or you could ask, hey, I think I need this. So basically we're kind of going to be in an interim phase where we don't have a specific lawyer. And then there's a way to deal with that. But we're specifically talking about methodology of legal reimbursement. So, and by legal reimbursement, I mean, who can evoke a legal bill from Panhandle? And so the short of that is, if you feel like you need it, either you're in the department or administrative or board, that it would need to be presented before the chairman, and with as much budgeting on it as you can, including a possible, like how many hours you think it might take. So then we can assess what would be the cost to the Panhandle. And then if for whatever reason there is also a recourse. So if you disagree with the chairman's desire, then it can be presented to a quorum of the board, which could be like a short-term emergency call if needed, if it's too far away from the next meeting. If it's like, the meeting's in a week, I can wait a week. But if it's like, no, we need to know by the end of this week, then we'll figure out how to get everyone on a phone call and have a emergent call specifically to deal with that, which is allowed. There's mechanisms for that. So that way we can then assess, is that an actual need? But if you're satisfied with the chairman's results, then no need for the board meeting. If you're not, then you have a recourse. So that's the general strategy I think I would like to do, because we are significantly over our budget. So ideally, it would be best not to have any legal services draw for the rest of the year. But this is a mechanism in the short time that I'm proposing. Any input or?
If I may comment at this point, I suppose if it were an emergency, it's legal CPR, the patient is going to die, then sure, you can have a point of access, and that would be the chair. I'm going to imagine that legal CPR occurs, once a year, maybe? Not even that, okay. So I think the usual would be, if anybody in this room wants legal services, whether it's administrative or board, put it on the agenda. It's a board decision. It's not my decision. That's for darn sure.
Yeah.
And actually, I've caucused this with many people. We went to the meeting in Boise of all the other districts, and then our training that we had 2 weeks ago. I queried what is the expected or usual methodology of engaging legal services, and the uniform response I got, it's a board decision. Well, that's amen. It is a board decision. I don't want to make it. I mean, I'm just 1/7 of the vote. Yeah. So what I would do, if I'm going to do nothing more than funnel the information, make sure it gets on the agenda. So if Glenn has an issue that he wants to engage legal, fine, talk to me, and then I'll tell Jessica, and we'll put it on the agenda. And then all of us will discuss whether the engagement of legal services for that topic is meritorious or not. It's that simple.
I think that's great.
And then, and on the event of, again, legal CPR, okay, talk to me, and if it genuinely looks like CPR, maybe, okay, what I would imagine doing is calling an emergency board meeting. That's probably what I would do. I mean, what do you have, 24 hours to call an emergency meeting or something? Well, the patient will still be alive tomorrow. Okay, are you okay with that?
Yeah, no, that's actually the other aspect I don't think I mentioned. I think that's perfect. So I think as far as non-emergent needs moving forward right now would be get it on the next board agenda, and we'll discuss it and do that. Short of an emergency need that's deemed too far to wait, then you contact the chairman for approval, and he'll likely call emergency board meeting.
And then I think in terms of, so there was a meeting or so ago where you wanted to have kind of an escrow account methodology, which I think in principle is a wonderful concept, because if I may put words in your mouth, what you're wanting to achieve is some limit on expenditures, and you want
a hard stop for the law
how much money
firm.
we've spent to have light shined on it.
Yeah.
Well, if we modify our policy of how we engage the lawyers by making every single instance a board decision per force, we're going to be talking about the budget.
Right.
You see what I'm saying? The fact that we're all talking about it, then the next natural question that Glenn's going to ask is, well, how much money have we spent? Because he's kind of a stickler for detail. But you see where I'm coming. And so the spotlight you're looking for will occur.
Yeah. And on that one option, and Christine, if you wouldn't mind, if you have a thought to chime in on this, but one option as an alternative that was thinking about, instead of a retainer, if that becomes kind of accounting wise not possible, would be to have a amount authorized up to with each bid for a legal interaction. So that it would say we're authorizing up to $1,000 for the law firm, and if you spend beyond that without reauthorizing more from the law firm, we're not responsible for that extra expenditure. So it's in essence kind of giving them an escrow account without them being an escrow account, if that makes sense. If you could let me know if there's any obstacles to that you can think of or have run into.
So, let's back up to what we had earlier.
Mm-hmm.
Of getting an estimate based on sort of the price.
Mm-hmm.
I think that would be much more realistic and easier
Mm-hmm.
to get that estimate and then on board to decide if they want to move forward or not.
Okay.
If it's approved, then we can do electric service and then.
Mhm.
I think that would.
Yes, no, I agree with you. I think that is a wonderful step. In addition to that, the authorization of work would include we're authorizing up to this amount, so you can't actually run past that without asking us if we want more work done. So we're not actually giving them money ahead of time for like an escrow, but we're just saying, I only authorize up to this amount, and you need to check with us if you think you're going to go past your bid. Does that make sense? So then they sign that, yes, you're not responsible if we run past this without asking you. So where it's more of a they're legally saying, yes, we're only going to spend up to that money or before we ask you again. So it's the bid, which is good, what you said. They'll invoice us, but they know they can't. If they bid $3,000 on a project and they actually end up thinking it's going to take them $5,000, they can't just send us a bill for $5,000. Even though, because we authorized up to $3,000, they would have to ask us again, and we'd be like, we're authorizing you 2 more hours, and please wrap it up. Just give us a report. Or we say, yes, please, that's that important. We're willing to go to the potentially up to $5,000.
So then, potentially services might be also maybe special meetings as well.
Yeah.
Or
Mhm.
that's what-
Exactly.
And I'm assuming that if it goes to $3,000, we're not going to just stop the service.
Probably not, but you can say, thank you very much. Just give us a report. That's good. It depends on what it is, you know. But a lot of times, if it's more of commenting on a contract, we're like, we don't want more comments right now. That's as far as we can forward. If it's more of like an ongoing litigation thing or something, we might have to do something more, you know, if it's still needed. So it depends on the situation, but it gives us that option to say, hey, nope, that's enough. Thank you. You've given us good thought points versus, oh, we actually need you to do more work for us on this, if that makes sense.
Dr. Nolan, frankly, I would unburden Christine of
Sorry.
that responsibility.
Yeah.
To be quite honest, when we engage legal services, there'll be a fiscal note. I'm all on board. We're all on board with that.
Okay.
So your line of inquiry, which is strong,
Mm-hmm.
is what if the legal services exceed the fiscal note?
Mhm.
I get it. Then we're going to have to just the board, not Christine.
Right.
That's why I'm saying I want to unburden her
Fair
of
enough.
that responsibility.
Mhm.
This is our responsibility.
100%.
And if the legal services end up short, well, then it's our responsibility to short it, not hers. And I think that's the apprehension she had.
I appreciate that. The next question is going to be, who's going to negotiate?
Well, exactly. No, and amen on all of that. It's really not. It's not fair to you to have you negotiate that. It really isn't. But it is our responsibility to negotiate it. So if it appears that the fiscal note will be exceeded, then they will contact me.
Yeah.
I in turn will contact you. I
So,
mean, it's
yeah.
either something that is reasonable and it doesn't matter. If
Yeah.
they are approaching fiscal note and it's legal CPR,
Mhm.
then we have to hold a special meeting.
For sure.
If it is something that can wait, well, then it's the next board meeting and it'll be on this agenda.
There you
It's
go.
that simple.
I agree with you. And Christina, as far as who would negotiate, I don't really see it as a negotiation per se each time. It'd be more of at the board meeting. It'd be like, okay, we approve up to this many hours at this rate. And that's just and we'll have like a standard authorization that then we send to them authorizing this work. And so then they have a document and then it's clear. But in the contract, it says they have to do that document. So in the original contract, it'll say that each instance will have its own details, and you have to abide by those details. And then so when we send the work order, kind of like if you do a change order for a contractor or something, there's usually amounts and things, and I authorize this and that. So you wouldn't have to negotiate that. It'd be more of the original contract, and they just know that they're going to for each ask that they're going to be engaged with, they'll have those numbers written on something paper that they actually get. So I think that way you don't have to enforce it per se. You just let you need to, the board, you can contact us if you see that need, but hopefully they're going to be already knowing not to knock on your door, if that makes sense. So, okay.
As an additional item, you had made reference a couple of times
Mhm.
of putting a moratorium on legal expenses
Mhm.
for the duration of this year, which in spirit, I am
Mhm.
wholeheartedly on your side. However, it might happen that we have legal CPR.
Mhm.
So this particular agenda item 10 does have the option of an action item. So we might want to entertain a motion along the following lines. Should it arise that we need emergency legal services, then the methodology that I've sort of alluded to now a couple of times would be contact the chairman, and then the chairman will basically call forth an emergency board meeting. I mean, it's that.
I could make a motion to try to summarize that. So for immediate legal policy, until we develop the comprehensive one, is any legal needs through, well, not just the rest of the year, but any future legal needs, needs to be put onto the board agenda for the next meeting. And then with that, there's an emergency provision that if there is legal CPR needed, that can't wait for a decision until the next meeting, next board meeting, then you contact the chairman, and then the chairman will initiate a emergency meeting for a decision upon that, so that we can hopefully get a decision within 48 hours.
Is that a motion?
That's a motion.
Do we hear a second? Any discussion? Roll call vote?
Glenn Bailey,
Yes.
Dr. Johnson,
Yes.
Commissioner Cowles,
Yes.
Dr. Nolan,
Yes.
Peggy Kabala,
Yes.
Chairman Fletcher.
Yes. Okay. Dr. Pinnock.
This update will be very short. I've made great progress in compiling data for the clinical services review. And I think that and I should say that everybody from Panhandle Health has been extremely gracious and good about pointing me in the right direction, giving me numbers, giving me documents, speaking with me, holding meetings. So I've talked to a lot of people. I'm heavy into the practice management software until my eyes are bugging out most days. Gathering trying to put together things and some kind of form to make it easy to look at. And I think that by the December meeting, I'll have a report that I can give you on the results. And what I would recommend is if the board is in agreement that if the December meeting works, to present the results during that meeting, which is mainly the factual data and my findings. And then at a future meeting, talk more about the opportunities in a SWOT type analysis, the opportunities portion of it, with some options of where the clinical services can go, and more of an open discussion with the board. I'll present my recommendations and have it more of an open forum type of discussion than just a presentation, let's say. So I don't know if that works for you, but that's what I'm kind of thinking in the back of my mind. I think it'd be too long to do the whole presentation in one sitting and people would fall asleep. So let's do it in two.
Okay, thank you. Any questions for Dr. Pinnock? You've got everyone
Speechless.
mesmerized.
Wow.
Well, thank you.
See, I already put you to
Is
sleep.
there, oh wait, I do have a question for you. Is there anything more we can do for you? How can we make your life easier?
One
better?
thing that I would like to do is to talk to each of the board members on a one-on-one situation to get your all impression about where things should go with clinical services. So I've sent a couple emails out. I'll send a couple more emails out, but I'd like to meet with each of you. So be looking for those emails. It shouldn't be a long discussion, and I'll take a half hour of your time. Everybody's busy, but just to get your thoughts. And I've got a meeting set up with Peggy on Monday. I'm going to go to St. Mary's, see the facility down there, speak with her. So starting to do that now, and I'd like to talk to everybody individually.
Okay. Any other questions? Eric, you happy with your newest employee?
Yeah, no, I've enjoyed discussing with Dr. Panhandle, and I appreciate his response.
Okay. Christine?
I apologize for the delay.
It's okay.
I have it loaded and I made a change. Okay.
So it's been a while since we've had a fiscal report. What I would like to do today is go over the September quarter end for fiscal year 26. Once we do that, then we will, if time permits, go over the June fiscal year 25 year-to-date report. The reason why I want to start with 25 is it will allow me to kind of orient you to those that are new to the budget to actual and how the budget numbers work compared to the actual numbers. It's very simple, but I just want to have you get the lay of the land. What we usually do is we start with the cash history. So this is for fiscal year 26. As of September 30th, we do this each month. We ended with a cash balance of $8,218,000. And what we're looking for here is months in reserve. Currently, we have 9.84 months in reserves. After we adjust for board committed funds, program restricted funds, opioid settlement funds, we have 4.8 million in general funds, which leaves us 4.05 months in reserves. I like to keep it at around 3.25 or 3.50 months in reserves. So sometime soon, I would like to approach the board about moving more money into the board committed funds. Board committed funds are those funds that the board has committed for future use, such as the 27th payroll, which we will be having, which will be coming up in a couple of years. So over the last few years, we've been setting money aside to be able to accommodate for that additional payroll. We have set money aside for vehicles and for building maintenance in the future. And one thing that I want to point out is we received an estimate for lighting on the roof. So within the next couple of years, we need to replace the liner on the roof, flat roof, and it has a skin on top of it. The quote came in at $352,000. So we want to be planning for that. We've also set money aside in anticipation of HVAC unit issues, and we've had some of those that you'll hear about here shortly. But buildings, as we've mentioned before, are getting old, so we want to plan for that. So I will be asking her shortly to use the funds for committee.
Can I ask you a quick question on the board? Are those currently funds that previous board meetings have chosen to commit for specific items? You're saying like these large items.
Yes.
Are any of those, are those more infrastructure and admin and staffing, or are they more for external programs, or, like?
Currently, they are for basically infrastructure.
Okay.
There's money in there for vehicles, we haven't touched that. There's building maintenance funds. There are funds that there for the 27th pay period. And it seems like there's another category, but it's not.
Okay, thank you.
Program restricted funds, those are funds that we receive that are restricted for a specific use, such as grants that we receive. For example, the senior companion program receives $15,000, and that will be dedicated to something that my management program. So that would be considered a restricted fund. We have currently, as of the end of September, $563,000 in restricted funds. So once again, we're ending September with 4.05 months. Any questions on this before you go on?
The opioid settlement funds. Is that a recurring settlement fund, or is that one time?
That is reoccurring, and the reason why I broke that out from the restricted funds is it distorts the restricted fund balance, because most of that is opioid settlement funds. And we're receiving funds throughout the year from different settlements that are. So we started receiving those, I believe, in fiscal year 23, it's when we started getting strong. got more in 24, 25, and really started receiving them in 24, I think exactly. And we will continue to receive as well.
Is there any way to determine will that amount increase or decrease progressively?
That's an interesting question. And Eric can speak to this as well. We're currently gearing up our opioid settlement program. We've just recently become an individual to assist with that program. So it depends on how, or we expanded out to the counties, how much we develop that, and how much we would like to spend each year. So it could balance itself out. We could reach the point where we budget based on what we receive. And what we receive is different from what we anticipate.
Those are for limited use as far as what it is.
Yes, the settlement, there is a settlement agreement, and it is relatively broad in scope, but we need to stay within that settlement agreement.
The federal thing needs to be monitored by federal.
It's not federal funding, it's funding pharmaceutical settlements, similar to, what we went through years ago with the tobacco settlement. So it's various pharmaceutical companies that are creating settlements. And Eric, he can better speak to that.
Just to add briefly to that, I think that, I don't remember the exact number, but a 16 to 18 year settlement repayment plan that involves the Sackler family, and it involves multiple pharmacies, CVS, Kroger, that type of thing. But I think what makes it challenging is that the varying companies, they're not following what they should pay this year and next year and the following year. Sometimes some folks will pay year 1, 2, and 3, and sometimes 2 and 3. So there's no good way for us to calculate what we're going to receive on any given year, but we do know that it is a finite amount of funding, and once these entities have paid the amounts out, then it will stop coming in and if some of these.
And do those funds have to be spent with a certain target?
I don't believe that they do. The Idaho Attorney General's office is part of the national settlement, and that it is specifically delineating what entities get it. The health district is one of the recipient entities as well as the counties. But there is an Appendix A associated with it that gives us very specific categories on how we can spend the money. So we do try to align very closely. If we have a question on if it's an appropriate expense, we do reach out to the liaison at the Idaho Attorney General's office to make sure that our expenditures are aligned with the
Yes, to jump off of Glenn's point, there is one is how much money has been spent out of the total amount we've gotten, and the other part would be for the different grants and restricted funds, like the restricted funds and then the opioid settlement fund, since it's restricted too. Would there be a guide for the board that would kind of outline each little fund we have, including the bullet point policies on what it can be used for? Because that sounds like something that, like you're saying, it's going to be coming for a while. We don't know how long. It's substantial, and it kind of, I think, would be good to develop with the admin and the board to develop a joint vision on how to utilize that best to serve everybody in the Panhandle. So that I would just like to kind of bring that into the open as far as like what's actually been used, what hasn't. We can kind of project possibly what we might get based off the settlements. And like you're saying, you may not know because it could skip year to year, but where we kind of bring that up a little more, where we're aware so that we can proactively move forward, whether it's, some of the different programs we have that we can stand up a little bit stronger to help support the things that led to that settlement. There's a lot of pain in that settlement. And so it'd be really nice to, serve the community really well with that.
The request is good because actually Kate and I have been in discussions on bringing that forward as an upcoming board discussion to share what we spent, where we're at, and what programs are
On that, and I'm sorry not to, I know we're still in the financial talk, so I'll be down a second, but on that, I would like to talk more about that. So maybe we'll put that on a board. I don't want to keep taking, so please
And
hand it
too,
back
Eric,
to you.
what are the options of where it could be spent too? 'Cause
Yeah.
I know there are options and I don't know the options. So
Yeah.
I would-
And I can share that appendix with the board. It's about yay thick.
Hmm.
So it's fairly exhaustive. There are a lot of options there. Being our focus is largely preventative, that's where we have focused
Mhm.
our efforts, but it goes into treatment recovery. I can share that.
Right. Yeah. Well,
That-
I also like a executive summary of it too, because you can kind of get lost in the weeds sometimes on that. But like, and then if there's priorities that you feel would be good, and then if there's priorities from some of the different directors, they kind of to conglomerate together what are areas, and then we can bring that together and develop. Hey, this is our actual like 5-year plan on what we want to do with that, including possibly investing it so that it doesn't ever go away. So there's like the LGIP and stuff like that. We can talk about that later. So
Yeah, but at least knowing options would be great from a board standpoint because they have some input because there might be in our opinion some better ways to use it too. You know,
Yeah.
that'd be great.
okay, back in.
Energy invested. We move in excess funds out of the general fund and do
Okay, thank you. That's great. I was going to ask you that, so you jumped the gun. With that, is there a way to do you profits on that? How is that tracked, and do those go back into the fund that the profit was generated from, or does that go into a new fund? Go for it. Thanks.
Any further questions? People see that in the back?
Mhm.
So this is the budget actual for September ending. And we budget, this is the 12-month budget that was approved by the budget committee in May. And this column represents the year-to-date budget. We do not budget with a line item. And this is budgeted based on, this year-to-date budget is 3/12 of the annual budget. So we don't take into account any fluctuation with each month and budget based on activity that we anticipate for any given month. So when you look at this and you see any variances, keep in mind that this is only 3/12 of the annual budget.
Mhm.
So we'll begin with revenues, and we can see that licenses, permits, and fees are currently over budget by $13,000. Health services, which is basically clinic and epi, is under budget by $119,000. Other fees, this is vital statistics, death certificates, sale of land. If you read your fiscal report in your package that went out, we disposed of several vehicles and we received $4,700 for those vehicles. Federal grants, we are currently under budget by $382,000. And what the board should know is we have estimated a loss of federal funding of approximately $539,000. And that's due to grants not renewed. Fiscal year 25, fiscal year 26. So
So what we're going to see is we had anticipated receiving some of that funding when we did the budget in May, March, April, and May. And we are going to see, because of a loss in that funding, we are going to see negative numbers. State grants, this is showing an over budget of $709,000. And the reason for that over budget is it includes opioid settlement funding. Approximately $486,000 has already been received this year. We are under budget in city county grants, and that is primarily due to an environmental program that we have, and it goes to some staffing issues, which we will see throughout some of these. Well, the staffing issues are also related to some of the other variances that we have in the grants, such as and the staffing and clinical. We are working on stabilizing our staffing. I think we'll see that when we go back to June year-to-date for fiscal year 2025. We're still being impacted by staffing issues. Here's the interest. I budgeted for $215,000. 3 months of that would be $53,750, and we have received to date $83,000. And I don't recall what the interest rate is. I usually have that on the board committed worksheet. I didn't include that this month, but I can provide that.
Is that primarily from the LGIP that you're talking about? Okay.
Rent, other, under budget by $2,500, we do rent space in the outlying offices. And donations, miscellaneous, that's exactly what it means. We do receive some donations, and the larger dollar amounts would be related to paper rebates that we might receive. And paper would be credit card system that we use. And this is just a timing difference for the county contribution, $70,000. By the time we get to the end of the year, it should be at what was budgeted for the year. Any questions on revenue? At the end of September, we are under budget in personnel expenses by $261,000. And as I mentioned, some of that is related to staffing issues. Operating expenses under budget by $176,000. Capital expenditures over budget by $14,000. And this represents the first phase of the HVAC system that was completed this fall. Now, one thing that is with the trustee benefits. So we're under budget by $99,000. What we need to remember when we're looking at some of these variances is we're only 3 months into the year. So some of these programs haven't even come up to speed, or we haven't paid some of our annual maintenance, that sort of thing. So that is going to create some of these distortions. Are there any questions?
A question on the trustee and benefits. What's normally fits into that category? What would be some examples of expenditures?
They're really not expenditures, but they are our pass-through funding. So it's a category. It's other non-federal financial assistance that is passed through. For example, on the opioid settlement program, we take applications for people that want to apply for those funds and use them to get back out into the community. So if their applications are approved and they're treated like a subrecipient, as if we received federal funds and wanted to sub-grant those out, we try to use that framework in vetting those individuals, those entities, and how they can use those funds. If their application is approved, then when payment is made, assuming that they have met with the then the payment is coded to this trustee benefit. It's just a pass-through of funds, it's assistance to a non-federal. The other reason that we do that is if it went into the upper category, operating expenses, it would distort our operating expenses and any expenses related to our programs that we're
Makes sense, yeah. So it really doesn't have anything exactly to do with the trustees, other than it's money that's used, like you're saying, to pass through to other entities that are trying to do good with funds that we have available. Okay,
and it's difficult to budget now.
I bet, yeah. And what's the current decision tree on that, as far as do you know?
Decision tree.
Well, I've never heard of it before, so I was wondering, like, is that like something that there's a packet and then the board looks at them and helps with the process, or who decides the funding and who gets funding and who doesn't?
For opioids.
No, for the well, it could be that could be one.
Well,
For the things that go through the trustee benefit, how does that decision tree occur?
there are program managers. It
Okay.
depends on the program. There may be programs where the program manager reaches out to the organization to assist in implementing a portion of the program. In that instance, we may pay them depending on their deliverables. We may pay those through trustee benefits.
Is that something that the director alone decides, or is it more, is there a subcommittee of staff, or is there?
Depends on the grant, how the grant is written.
Okay.
If it's federal funds.
Okay. So it just depends, but yeah, it'd be great to learn a little bit more about that process. So yeah, thanks.
So we end with an excess of $655,000. But what we need to do, because we're cash basis, we need to adjust for the accruals. So we need to adjust for any accounts receivable, any accounts payable that could be residing in the figures above. Once those adjustments are made, we factor in the beginning cash balance. So we have our excess minus our accounts receivable in this instance, plus our payables, plus our beginning cash balance. And that brings us back to the ending cash, which ties to the cash history report we just saw. Any questions? Are we ready for June? Do you want to look for June?
June, I mean, is that year end, basically, the June
Yes.
would be looking at all of 24-25 fiscal?
Yes.
Okay, thank you. Yeah.
So this is pretty historical because what's more important is the cash balance in my reserve as of. So just, it's the same process, no different, but in June, we ended with 4.51 months in reserve compared to 4.05. So it moves. All right. So this is for the 12 months ending, fiscal year end, June 30th, 2025. We can see that licenses, permits, and fees, we were under budget by 10,000.
Christine, with that, can I ask you, when you say under budget, was that the amount that was expected to come in or the amount that the program cost in our outlay?
We expected to, we had budgeted licenses and fees of 1.8 million. We actually received 1.79
Okay.
million. So we were slightly under budget by 2,000.
Great. I said we were in the revenues column. That's why I was just wondering. So then, do you have one that correlates to like what that program cost us on our end, and then what the net was for that program? Not just the budgeted income, but like the.
Yes, yes, we do. And I think I would like to take this opportunity to make a suggestion. I volunteer for an organization. I'm on the board of the finance committee. And what this organization does that is incredibly helpful is they have a finance committee that meets monthly. And it is made up of some of the board members. They have a chair of the finance committee. And they discuss monthly the financials. And the committee members are given the opportunity to go down into the weeds and ask questions and better understand the organization. I very much support the idea of creating a committee so that a lot of these questions can be answered and dealt with at the subcommittee level. And if the need is seen that it should be brought forward to the meeting, then it would be elected to do so. I think it would be very, very helpful. So I would appreciate if the board could consider that.
Consider it done. It's a terrific idea, long past due. And in fact, Eric and I have been in discussions. We're going to make that happen sooner than later.
Yeah, thank you. That's a great idea.
Okay. So home health. Some of you may not be aware that we have a home health agency which closed down, if I remember correctly, in 2023 and early in 2023. And we still get some residual income related to that. So that's why we still have it appearing on our financial statements. That $24,000 is an annual payment that we receive based on the home health Medicare cost. So it's always in arrears, and that is, if I remember correctly, this is 25. If I remember correctly, that payment was for fiscal year 23. So we should receive probably 2 more years, not 23, 21. I anticipate that we may receive 2 more years, but the payment will get smaller. And also included in that amount is some collection fees. Health service fees, this is clinical and epidemiology. Fiscal year end, we ended under budget by $227,000. Other, I think we have a little miscoding here. This should be part of other fees. Once again, this is vital statistics. Grants and contracts, we are over budget by $176,000. Interest year to date, LGIP, $187,000 over budget. Rent other, $31,238, and donations miscellaneous over budget by $4,800. So in total fees, contracts, and miscellaneous, we are over budget by $199,000. And you can see here, county contributions basically come to 0. So Any further questions on revenue? Moving on to personnel expense. We are under budget by $940,400. And that is due to the staffing challenges that we've had. We had budgeted in fiscal year 25, if I remember correctly, I think it was 98 FTEs, 98.9 FTEs, and our actual FTEs, full-time equivalents, were 88.97. And that is not all related to clinical, and I don't need to be calling clinical out too much. This is pretty much across the board. All of our programs are impacted by staffing in fiscal year 25. And your revenue is going to impact your expenses. If you don't have the money, you're not going to spend it. So our operating expenditures were also under budget by $836,000. Capital expenditures, we were under budget by 106. Trustee benefits, under budget by 28,000. Our total expenditures were 1.9 million under budget. So that leaves us with an excess of 1.5 million. If we adjust for our accruals, add in our beginning cash balance, it brings us back to our ending cash of 7.8 million for fiscal year 20. Any questions?
Just a quick question on the year from the different years ending balance. Is that been typical for, say, the last 10 or 15 years, or is that more since that increase in ending balance, is that since the opioid funds started coming in? Would you say, is there a specific reason why the funds have been growing?
Well, part of that is due to, yes, the opioid settlement funds. If we look at fiscal year 25 here, we have 2.5 million sitting in cash, which is going to be reflected in this ending balance.
Yeah. Mhm. Okay.
Any further questions?
It's very helpful.
If there are no further questions, this ends my report.
Thank you, Christine.
Thank you.
Eric,
You're on the bubble. Thank you, Chairman. I'll keep this very brief. I wanted to follow up with the board on discussion from last meeting on Idaho risk management and their willingness to participate in one of our meetings, to be available for questions. Faith Knowlton, she's the statewide risk manager with the Department of Administration. They're certainly interested in participating in discussing the matter with the chairman. It sounds like there's a need for an opportunity to formulate some questions before we have them on the agenda. They weren't available for this meeting, but they're certainly available for whether it's the December or January meeting to answer questions. So just let me know, and I will set that up in a future meeting. Other item in our IAC training, there was some discussion on public records request policy and a few changes that have been made in the last year or so. I guess, interestingly enough, the difference between no charge if you're a resident requesting information and charge if you're a non-resident. I did do a brief query. Frankly, not in nutrition services and clinical, we don't get public records requests. They're very rare, if at all. The bulk of our public records requests come through environmental services, and in fiscal year 25, we had about 76 of those. So that's where, if you're interested, that's where our requests are coming in, and I know we get some very large ones. So what you'll likely see at a future meeting is us bringing that board policy on public records requests to reflect the new or the change in rules where we have outside interests that are asking for copious amounts of information. So
Do we know on that approximate cost for those requests of staff time, kind of, our cost?
They vary. Some are,
Yeah.
some we can fill in a matter of seconds.
Yeah.
Some are historic files that are.
Yeah. I mean, more of like over the whole year, like,
Oh.
approximate cost, like. Yeah. Totally. Okay. Okay. Right. Right. Yeah. That'd be a good one, for sure.
We can bring that forward when we bring the updated policy for board review and signature.
Is that policy established by health district or by each?
We have our,
State.
we have our own policy, but it basically points back to the state. Yeah, the state statute, yeah.
Yeah. Like he was saying, the
What would be
state,
specific to
yeah.
us is how we execute it.
yeah.
Yeah.
There's certain criteria we can't change based off the
Right.
state and certain flexibility we might have, but so.
And really the significant change we're discussing is having our records request form reflect that if you are a non-resident, we can charge you for that maximum fund. The final item that I had, which seems like less of an issue, I wanted the board to be aware of WIC funding with the government shutdown and the discussions that I'm sure you've all heard. If the shutdown was going to continue longer, it would create some difficulties because that program is carried essentially by federal funding. There have been weekly updates by the state representatives. As of last week, there was adequate funding to carry the program into early December. It does seem like on the federal level there is movement toward resolution, so it may not be an issue, but did want the board to be aware of it.
Just a quick question on that is, what is our current average monthly pass through on the WIC fund? For use, say per month we're spending 100,000 through it, or
As far as our
how much?
employee costs or
No,
or
the actual
benefits?
money benefits, the benefits.
Benefits, they are over 200,000 as far as, if I can remember correctly.
With that, sure, that's all.
Okay. Any other outstanding issues or comments or before we adjourn? This is your moment, okay? You always-
I'll make a motion to adjourn.
Oh, there you go. Do I hear a
Second it.
second?
I'll second that.
Okay, we are adjourned.
Thanks.
Oh.
From afar.